This
Yeah,
conference will now be recorded.
okay. I had chemo. I ended up my sixth session about a couple months ago, and I think it was the Neulasta that started my back pain to begin with, but it's gotten worse, and then it got better actually. And then when I started Zytiga, it's gotten worse again. And I was wondering if anybody knows if Zytiga might be a problem with that.
Jim, I'm sorry, I missed the first part. Yeah, what was it that was
While I
bothering?
was while I was getting chemo, I think the Neulasta shots were bothering my back towards about the third or fourth session.
Right.
And then it started getting better a month ago when I stopped all the chemo. But now my back's gotten worse again after I started Zytiga. So I'm wondering if Zytiga has any issues. I did get an MRI on my back, and it's a question whether it's a degenerative disc, or it might be a tumor, or it might be, they don't know. So I'm just checking if Zytiga has anything to do with prolonged backache.
Jim, is it lower back pain?
Yeah, my lower right back, and it doesn't go shoot. It's kind of like, um, uh, a pinched nerve. It doesn't go all the way down my leg. It just kind of sometimes wraps around the top of my leg, but it's mostly lower back right. Very low.
Okay. And have you had a history of low back pain before
Uh,
prostate cancer?
I pulled a muscle mild back, lifting up. I've had, lower back issues, but it always was better. So it might be something to do with the muscles and tendons too. Yeah. But during chemo, the last chemo, my whole leg blew up. My knee blew up and my back felt bad. My whole leg, my ankle blew up. They thought I might even have a blood clot, but I had a sonogram and that looked okay. And then it's gotten a little bit back to normal now. So I don't know, having all kinds of issues, and now with the back pain. Otherwise, I'm feeling pretty good after the chemo and everything. I just can't walk too good.
Well, what did the docs tell you about the blowing up of the leg after chemo?
And they didn't know, what might it be. They just don't know. I've got an oncologist, UCFS, Dr. Borno. We got Dr. Okazaki here. And both of them looked at my MRI after I complained about my back, and they both thought that it's degenerative disc, but they don't know. There's other spots, but they didn't know if it's from old issues of cancer in it or if it's active cancer. They don't know that either.
And you're taking prednisone with your Zytiga?
Yeah.
And you're taking the 1,000 milligrams on an empty stomach?
I've been doing 500. I started taking 1,000, 2 pills, and I got such intense hot flashes and felt so miserable. I talked to Dr. Okazaki and I cut it down to 1 a day, 500 milligrams.
And you're also on Lupron?
Yeah,
How much prednisone are you taking?
a 5 milligram.
Well,
Go ahead, Jake.
I was just going to say I'm on Zytiga. I've never had chemo nor Neulasta, but Zytiga is known for causing some joint pain. So it is possible that your back pain is coming from that.
Yeah.
It could also be something totally unrelated. It could be, like you said, a muscle pull, or it could be like a kidney stone.
Peter, you've been on Zytiga for a year, I believe, or you were.
I was last year, yeah. I never felt back pain from it. I tolerated it pretty well. I mean, I had leg issues, but I think that was the Lupron legs. I don't.
Yeah, I had the back pain before I started Zytiga, but it was getting better. And then when I started Zytiga, it got worse again. So I don't know if Zytiga is the problem or not.
Yeah, I'm not aware that Zytiga would cause bone pain, which it sounds like if you're talking about low back pain, I'm interpreting that as some pressure on the nerve from the vertebrae. And I'm not aware that Zytiga would cause anything like that. In fact, maybe what you might want to try is taking a second 5 milligram dose of the prednisone, because I believe that's what the package insert specifies. That's the way the clinical trial was run when they got approval for Zytiga. It was with 2 5 milligram doses a day of prednisone. And that's a powerful anti-inflammatory. It may improve your back pain.
That's interesting. Dr. Okazaki here, the oncologist, suggested just to leave it, twice a day doing ibuprofen basically. And that helps a little bit, but not that much. And Dr. Borno and UCFS suggested I go back there and talk to an orthopedic department to check my back out. So what I did was I talked to my PCP here about seeing an orthopedic doctor, and he emailed me back saying there's only 2 guys who are knowledgeable about spine, and they're both surgeons, or spine surgeons, orthopedic surgeons. And then the PCP wrote me again saying, well, Dr. Fowler could see you, who did my radiation on my pelvic, before I did the chemo. And for me, it's like, God, that's all I want to go see is want to see a surgeon. I want to see a radiologist. That's great. Those are the guys I want to stay away from.
Well, every orthopedic doctor is a surgeon. They all do surgery.
Okay.
It might not be a bad idea to go to an orthopedic doc and have them do an MRI of your back to see if, in fact, you do have a stenosis or narrowing of the vertebrae that's putting pressure on sciatic nerve or some other nerve.
Yeah, well, I did an MRI at the diagnostic lab here, and that's what Borno and Okazaki looked at. But apparently they're not saying, something pinching it, and it's pretty sure it's that. So that's why they both are referring me to somebody else who knows more about spines.
Okay.
I mean, living on Maui isn't easy sometimes. You're kind of floating around trying to find somebody who knows, what might be the problem.
Anybody else have any suggestions for Jim?
And then it's Ken Anderson. I've battled with back pain since maybe 3 months since I've been on 3 months after going on Lupron. And mine, and I don't know about you, Jim, but is the pain present in the morning when you wake up?
Yeah,
after a rest?
Yeah, I'm late. I wake up, and the last week it's gotten better. I'm not painful all night, that I actually sleep, and I'm okay. And then as soon as I get out of bed and I walk, for 5 minutes, it comes back real hard. It's toughest in the morning.
It's much different than mine. Mine is due to like muscle fatigue. So, and I find the more I exercise, the better it is. But it definitely is back pain. And I think it's from, muscle fatigue or having been on Lupron so long, or it's much different. So I guess I don't have any comments in regards to your case, Jim.
Yeah. My legs are like that a little bit, but they're not painful. It's just fatigue.
So under side effects for Zytiga, they mentioned joint swelling and discomfort in 30% of people as a side effect of Zytiga.
Right. Well, I should be in every trial because I'm always getting the side effects of the 10%. This is ridiculous.
Well, this is 30%. This is a 30%.
Yeah, well, I'm in that group for sure then.
Well, Jim, one possibility, this is a wild card, is to hold a Borno and see if she can, you could, on your way to Los Angeles, fly up to San Francisco for the day on Thursday, fly overnight on Wednesday night or something. We could change the flight and go up there on Wednesday night and arrive Thursday morning and see someone up there before flying down to LA.
That's an idea. I was going to write her and ask her to send my MRIs to the ortho department and have somebody, talk to me. I did get, by the way, and this is a by the way, I was asking for trials at UCFS, what I might be able to qualify for. And Darwin, I guess, is the head over there for BRCA2 trials, heredity department. At first, I was told, no, they won't do any phone conversation and even tell me about the trial or if I would qualify or anything about it. And then a week later, they called me back, and I have scheduled a telephone meeting with her actually next Wednesday. So that should be interesting. They'll tell me what, if there's anything that might be available to me.
Well, you might call Borno's office, see if she can pull some strings, and if she can see anybody on Thursday morning, you could fly overnight on that Wednesday.
On Wednesday, change that. Well,
fly
yeah.
overnight, arrive Thursday morning, go to an appointment, and then fly down to LA later that day.
Let's see if I could pull that off. I'll double check on that. Right now, I'm scheduled to leave Thursday, I think. I think that's right. Okay. I'll look at that, see if they could do anything, figure that out. I mean, the guy got the MRI. They've got it there. She has it. I don't see why she can't give it to somebody and have them talk to me and say, yeah, come on over. I could show you what I could do or whatever. I don't know. I know they like to see you in person first before they do anything.
Right, but it's possible to we could change.
Right. Yeah.
Get over there Thursday.
Yeah. If I could pull that off, I'll see.
Okay.
Yeah, it usually takes a few days for them to answer anything and get it together, but we'll see.
Right. I wouldn't change the prednisone without talking to the doctors, though. I wouldn't experiment with it. I would make sure they're on board before you try doubling the dose or something.
Yeah. No, they'd all freak out. I'm the guy who keeps telling them I want half of what you're giving me.
Okay.
Yeah, but maybe not so much when it comes to prednisone, because a lot of guys feel that, I think it was Dennis Correa said that he had pains that just melted away from arthritis when he was on prednisone. Am I right, Dennis? Was it you?
Yeah, I used to have fairly consistent low back pain, probably associated with my golf game. And that kind of got very, very much better after going on the prednisone. Yeah, I was going to ask you a question about, Jim, about your, when you got the Neulasta, was the pain similar? Did you get pain after taking Neulasta?
Yeah, when the first two shots, the first two chemos, I had Neulasta, and it was pain all over different parts of my body, like somebody taking a hammer to my shin or elbow or whatever.
Yeah, did you try Claritin?
Yeah, I had that.
Okay.
2 days before and a few days after, I did those. I did that. And then it was okay, the third one, but then the fourth one, it started hurting my back mostly. And I thought Neulasta was the deal. The last chemo, they didn't give me Neulasta. The doc said, nah, just don't even do it. And so that's when it actually started getting a little bit better until I started doing Zytiga, and then it started getting bad again. But I don't know if it's the meds or what.
Well, just for the heck of it, Claritin is over-the-counter stuff, and I have continued to take one Claritin every day, and I am still free of that, what I think was like a muscle nerve pain that I was getting before that I don't get anymore.
Yeah, I still have some of the loratadine, the 10 milligrams. Is that the same thing? I still got about 15 of those.
I don't know, is that the same thing as Claritin?
Yes. Yeah.
Okay.
Same thing.
So maybe I should take one of those today. I'll try that because I didn't take any the last chemo because I didn't have the Neulasta shot. So I have some of those left. So I'll try that. And I'll kiss you if it works over the internet.
Dennis,
Yeah.
Are you on chemo? Is that why you're taking Claritin?
Well, I was on chemo. I did the full regimen, the docetaxel, and then about halfway through the chemo, my white blood cells crashed, and I got multiple pulmonary embolisms in both lungs. And was in the hospital
Right.
for a little over a week, and that's when they finally decided to start adding the Neulasta, and that's when I started to get the back pain and stuff, and the Claritin worked, and I just kept taking the Claritin.
Well, that's what I'm asking you. Why did you continue taking Claritin if you're not getting Neulasta anymore? Just curious.
It seemed to help with my little bit of allergy, sinus stuff. I used to be very prone to sinus infections,
Okay.
and so I just kept taking it. It doesn't make me drowsy. It doesn't seem to have any other adverse side effects. It's pretty, relatively inexpensive compared to the other drugs and stuff. And so I just keep taking it, and I feel better. I haven't had a sinus infection in 3 years since I've been doing all these other drugs.
Yeah, Lois is his handicap too, apparently, on the golf course.
No, that's the prednisone, corticosteroid.
Oh, okay. I'm
The
gonna have
guys
to
are telling
try.
me I've got an unfair advantage because I take the steroids.
Yeah, you're a drug-aided golf game. I know.
Yeah, whatever it takes.
All right. Anyone else like to comment on Jim's case? Or we'll move on.
Then somebody just joined on the telephone a few minutes ago. Would you care to identify yourself?
This is Jerry Pelfrey.
Hi, Jerry.
Hi.
Hey, Jerry. Jerry, do you want to take the floor sometime tonight to tell us what's on your mind?
Yeah, I may give you a little update. Yeah, and one question. So yeah, later on.
Okay. Duly noted. So let's see. How about if we swing to Jake? You said you had a question. Oh yeah, about the foundation medicine gene
Right.
stuff.
Yeah, I had the foundation medicine liquid biopsy a couple of weeks ago, and I got my results. I did share them with Len and with Rick. And I just wanted to ask, I think I know the answer to this, but I just wanted to ask Len to confirm this. They did find a few mutations, and they had provisos saying that abiraterone and enzalutamide probably would not work for me. Now, I was on Xtandi for 2 years, and it did work. And it's too early to tell if the Zytiga is working or not. But is that mutation? Did that come after or while I was taking the Xtandi, or did I have that mutation all along?
It's most likely that you develop that mutation after being on Xtandi for some period of time.
Okay.
That's usually how it works, how it happens. And that's why you became resistant to Xtandi.
Okay. That's what I thought, but I thank you for clarifying that for me.
Yeah. Yep. So I think were you gonna talk to your oncologist about your next step, or you're just gonna see how Zytiga works for you first?
Yeah, I'm gonna at least well, she called me today, told me that she got the results from Foundation One, or the office called. So I'll talk to her about them when I go in to see her. But yeah, I'm gonna try at least one more time with the Zytiga to see if it had any effect. I think I told you last time I had been on the Zytiga only 3 weeks when I had my blood test, and even though my PSA did rise, it only rose 10% with a doubling rate of about 7 months compared to what it was doing on the Xtandi, which was like doubling time of once 1 month. So I saw that as an improvement, and I was hoping maybe the Zytiga would have some effect. So to answer your question, yes, I'm going to wait at least one more time to see, maybe even 2 more times before I talk to her about the olaparib or the other ribs. Like, I can't remember all the names.
Yeah. Yeah, when I went on Zytiga, the first 2 months, my PSA rose slightly. It wasn't until the 3rd month that it started going down. And they call that Zytiga flare, just like you get a flare on testosterone when you take Lupron. It's not the same mechanism, but I'm not even sure they know why that happens, but it does happen. So, yeah, you might want to hang in there.
Okay. Thanks. I didn't know about the Zytiga flare. That's something new.
Yeah, I had that. But you didn't have that, did you, Peter?
No, it didn't affect me that way.
Yeah. And Dennis, when you were on Zytiga, right, Dennis?
Yes, I was. I'm still.
And you never had any flare from it when you first started taking it in the PSA?
No,
Did it go up?
PSA just started going down from right away.
Yeah.
How
Yeah, I
long
think
did-
it's something 30% maybe get the flare.
Okay. How long does it take for the Zytiga to start working, if it's going to work? Dennis or Peter or
Mine went down within the first 3 months. I get my blood work every 3 months, and it started going down right away.
so again, that tells me that I'm going to wait at least 2 more times before I ask her to try something else.
I think it starts working pretty darn quick right away. I know it comes out of your system right away too when you stop. It doesn't hang out like Lupron does.
Yeah.
Thanks.
Yeah. That's why you have to take it every day. Okay. Let's move on to Jim from Colorado.
Hello.
Hello.
Okay, I had it on mute, so I had to make sure I got it off right. Well, one quick thing, and this came from a conversation from somebody that was on this call, maybe a month ago, and asked about CBD, and I thought I'd give it a try. I live in Colorado, so it's easily accessible, and I used the CBD for a couple of weeks, and I stopped taking the estrogen that they prescribed me for handling the hot flashes. And I know this is anecdotal with nothing to back it up, but the CBD has reduced my side effects from my Lupron, my Zytiga, and all the rest of it. I'm sleeping. I'm not getting up as much during the night, and my hot flashes, at least, again, anecdotally, seem fewer and less intense since I started the CBD, and I'm on my 3rd week of it. So, and I was able to stop taking the estrogen, which was messing with my brain along with the rest of the ADT. And at least I got one out of the way, and it seems to work. So for what it's worth, and again, I'm not recommending this to anybody because this is just my experience, but the CBD seems to have eased the side effects from the ADT.
How much are you taking? How much CBD are you taking every day, Jim?
I'm taking 2 vials, one in the morning and one at night, and I put it under my tongue. It's a tincture, and it's 1,000 milligrams per bottle, and there's 30 per bottle. So it's essentially 2 weeks worth at 1,000 milligrams. It's a relatively low dose. And they said if it seems to work and you're feeling better, we can get you a better price by upping the potency and you taking less. But I went with the smallest amount, and I was chicken, but anyway, it seems to have worked, at least in terms of the hot flashes, and I'm not waking up. I was waking up 10 times a night. Now it's 4 or 5. And I don't know if it's due to that but I've been on Lupron, Firmagon, and Lupron and Zytiga for almost 2 years. I took a 5-month break, and I had to go back on when my PSA, went from 1 to 48 in less than 5 months. So I had to go back onto the ADT, and then they gave me the estrogen pills to offset the hot flashes, and that just made me feel even worse than the ADT. So I thought I'd give it a try, and I did, and the CBD, at least for me, seems to have had a positive effect on the side effects. And I don't know that it would work the same for anybody else, but for me it worked.
I started taking CBD at night too, and it helps me get through the night. Yeah, I could do 3 hours now without waking up. I started doing CBD.
That's exactly what for me.
I would. This is Jerry. I would second everything you've said, and I've been doing it for 7 months. I'm a newbie. I only was diagnosed 7 months ago, but everything you said, it lowers the number and the intensity of your hot flashes, and it will help you have a good night's rest.
It has absolutely done that for me.
Yeah, and it has for me and a lot of other fellow friends that I know. So, no, it's that is a fact. But again, that's my opinion.
Well, I just wanted people to know that this worked for me, or it appears to be working for me, and I would if it's legal in your state, I don't know how it works, but it's. And I talked to my oncologist about it, and he said give it a try. And he had no objection. So I said, it won't interact with anything else. And he said, no, it'll be fine. So anecdotally, it worked for me. I'm glad to hear it's worked for other people. And I hope that if they do some studies, the word gets out. Now, my second question is kind of a darker note. Does anybody else, I was diagnosed almost 2 years ago. My PSA was 233. My biopsy showed 100% involvement, ragged edges, Gleason 9, and I was told, you can't do any of these things that are going to make you healthy again. All we can do is help you to live a little longer. And I said, well, how long is that? And he said, and again, this was the urologist, not my oncologist, although he wasn't much more positive, and neither was my second opinions. So they all said it's because it metastasized into my lymph system and into my bones. I had 7 Mets altogether. And they said, we can keep you going for about 6 months. Then it's going, that's about how long we expect this to last. And then there'll be 6 months where maybe more that you might, so everybody said 6 to 12, maybe 18 months. I'm sitting here 2 years later, and I'm in as good a position as I was when they gave me their diagnosis. When I informed my family and friends of my diagnosis and what the prognosis was, a lot of people flew out, a lot of family came to visit me. My friends came from all over the country. They thought I was going to die in 12 to 18 months. It'll be 2 years next month. And I'm totally in no worse shape than I was then. And this sounds weird, but I feel guilty that I'm outliving my prognosis. And I feel like all these people gathered round because they thought I was going to die. And 2 years later, I'm still in the same situation I was when they diagnosed me. And I expect that I will maybe 2 years from now be in the same position. They won't do radiation. They won't do surgery. So I'm stuck with ADT. And I just got to figure out how to manage it. But has anybody else outlived their prognosis and had a guilt that you're alive and that you're doing okay?
I can vote for that. This is Les. I was diagnosed in beginning of 2013, given less than 2 years to live, and I told a few people, friends and family and so forth. And like I say, that was 2013, January of 2013, and I'm still here. And I feel guilty too, and I feel odd because there's been friends of mine that had sympathy for me at the time that are now gone. And I really feel guilty too. And so I know exactly what you're talking about.
Jim, this is Jake. I was diagnosed with stage 4 in 2012, June of 2012. And nobody ever gave me a prognosis. You know, they didn't say 6 months, 2 years. Nobody ever told me that. I asked my oncologist, and she said, we just don't know. She said, you know, she knows some people that have lived 20 years with stage 4 prostate cancer with the treatments that are available today. So all I would say is any doctor that gives you, a due date or drop dead date is probably not a very good doctor, number one. And number two, just use me as an example. I mean, I'm not in the best of shape. I don't always feel as good as I should, but I'm still alive 7 years after the fact. So, and I don't feel guilty. When I found out I had stage 4, to me, stage 4 meant terminal. And
right.
I told my family and a few friends that I have, I put it on Facebook. I figured I'd be dead within a year. Just making an assumption. So I'm still here. I don't feel guilty about it, but that's for what that's worth.
I feel like I let people down. It's almost like these people came to comfort me, take care of me, my family and friends, and and now it's almost like, look, you don't weigh 80 pounds and you look reasonably healthy, and I feel like I've let them down in some way, that they went through all this work to comfort me, and based on the prognosis, and I agree with you, and they didn't, give me exact, they gave me ranges, and they said, this is what normally happens. Because I had to get my affairs in order for I didn't have things set up. And so I maybe pushed them a little too far in terms of giving me some information, because I wanted to make sure I had everything kind of lined up and I didn't leave a mess for people. And when you get the diagnosis of stage 4 metastasized, it's, we can't do anything except prolong your life a little bit. And then you read the information and you go, okay, 6 months here, 6 months there. And, you know, some of this I probably came to my own conclusion because they said the same thing to me. Well, we can't tell you exactly. Everybody's different. And that's obviously true. But I do feel that people went out of their way. And now I get the feeling 2 years later that they almost feel cheated. And I'm sure it's my head, not theirs, that feels that way.
Jim, I think this is something that almost everybody that gets this stage level of prostate cancer kind of goes through. You start out and you get some ideas, rough ideas. If you don't do anything, how much longer will you live? And then you look at the clinical trials on some of the specific drugs, and whether it's chemo or Zytiga or whatever, and they give you survival numbers, and generally in months, 12, 24. Those are not exact numbers. That's like a range, you know, that's probably in the middle of the range, and a lot of the people are going to live longer than that, and some are going to live less than that.
Right.
So to think that you're going to be able to predict what your overall survival is going to be is probably next to impossible, and everybody responds differently to the drugs. As far as your feelings, you know, I've had the same thing when I got my diagnosis, and it was pretty dire. And you know, there's no cure for the stage 4, but there's a lot of treatment, and the treatments keep coming. There's new stuff, new trials all the time. So okay, and you know, I'm gonna be 74 this year, and what the heck? I'm feeling pretty good now too, the same way after on all of these treatments. But your friends and family, yeah, you know, you look at it because I'm here. My daughter's got one back in Ohio. I'm in Arizona. Another one in Memphis, Tennessee. And you know, they at first diagnosis, they were all both coming out here. You know, taking turns back and forth. And then, you know, as I start getting better and giving them the good news that's terrific. I did get a lot of, you know, people supporting me from that standpoint. That's terrific. The treatments are working, you know. But I guess I never felt like I cheated them or anything. So it's probably a little psychological stuff here, and you could probably get some help with that if if that's to the point where it's really bothering you, continuing to enjoy the things you want to enjoy, and do the things you like to do. Some psychological help might help with that aspect of it if it's to that point. But no reason to feel personally take it on as something that you didn't do. You didn't die, so you're gonna feel bad about it.
Exactly.
Rationally, I know that.
Yeah.
It's I know that on an intellectual level. Rationally, absolutely. It's just this nagging thing when they call or go, how you doing, or I see them again, and it's like, well, I thought you'd be dead by now. That's what I think is going through their heads. Yeah. I know it probably isn't.
Yeah. Well, they're not as familiar with the treatments for prostate cancer as you and most of us that have the disease are, and know there's a lot of variability, fluctuation from person to person, and how they respond.
So this is Jim. This whole thing's a trip. I had the opposite. I was doing chemo, feeling like crap. My brother come over and say, "Oh, you look great. You're doing good. You're no problem." And I felt, well, geez, maybe I should look worse.
Everybody's got the same situation that you have, I'm sure.
The thing is, it's an average. When the doctor told me that I had less than 2 years, and I had confirmed essentially by another doctor, an oncologist, the thing is, they were going by average. I also talked to my family physician that about someone else that had a Gleason 10, because I've got a Gleason 10, and they were diagnosed a long time after I was, and they've been dead a long time. So it's all on a curve. You know, they can only say what the average is, and mine and yours happen to be on the better side of average, and I'll take it.
No argument there.
Yeah, this conversation reminds me a little bit about last week when Professor Bill Burhans was speaking. I mean, he sounded really strong and great, and I would love to see him around for another 10 years or so. He didn't seem bogged down by the fact that he kept referring to the fact that he felt better than he had in years, which was remarkable, and yet he entered hospice. So, and for me, I was not given a number, but I immediately realized that this was just not about me, that I needed to get involved helping other guys. And, even guys with low-grade Gleason 6-degree disease feel like they're going to die tomorrow. And so, get involved in advocating for other men and helping them realize that we've got a long way to go. And someone just said treatments are changing all the time. I mean, I've been taking scans and treatments that weren't FDA approved or even conceived of 5 years ago when I started on this journey.
Okay.
So my attitude is give people something to feel proud about. That you're not just involved in yourself, you're helping others, and that's giving you momentum to keep going as long.
That's good advice.
You got a new purpose in life, and it might inspire other people to change their attitude.
Good advice. Thank you.
Very
Good
well
point.
stated, Peter. Yeah, I agree with the other guys, Jim, that this is strictly in your head. Nobody's wishing you were dead or disappointed that you're still living. Hey, look at the bright side. They got to see you, maybe people you wouldn't have otherwise have seen. And anyway, if any of them have that issue, that's their problem, not yours.
I don't think they do. I think it's in my head.
Yeah, I think so. And also, I also think that you possibly overinterpreted what the doctors were telling you. They may have told you, well, we can't be sure. And then you said, oh my God, it must be 6 months to 12 months. Because I can't imagine an oncologist worthy of hanging a shingle is going to tell a guy with even stage 4 prostate cancer that he's only got 6 months. That just doesn't, in my experience, that doesn't happen.
No, it was a urologist. The oncologist said we can, we have options. We'll get creative, and he was far more positive than the urologist. When I switched from the urologist to the oncologist, I did my own research and my own understanding that it wasn't 6 months and then 6 months of pain and then you're probably going to be out of here, which is the urologist. And that's why I left them, went to an oncologist at the regional UC Colorado Health, and went to the oncologist was pretty straight that there wasn't a lot he could do, but this didn't mean that we couldn't drag this thing out for at least a couple of years. And that was almost 2 years ago. So yeah, he was not as negative as the urologist was. I think he was just disappointed that he couldn't do surgery or recommend surgery.
Yeah. The only thing I can think of is the urologist, as you stated, he knew there wasn't much he could do for you. And so he just passed you along to the oncologist. And urologists typically don't deal with guys as their disease is progressing. They do their surgery and whatever happens, happens. And if your disease does progress, you just go on to the oncologist. You never see your urologist again, so he doesn't know
Right.
what happened to you. They don't have experience to know how long people survive, even with stage 4.
At the time I was diagnosed, I didn't know that. And I know it now, but I didn't know it at the time.
Right.
And so after talking with my wife, we decided that we would make sure, we were going to let people know. We weren't going to keep it a secret. And so, we talked to our family and friends and said, hey, this doesn't look good. They can't do this. They can't do that. And we were going off the urologist, but the oncologist wasn't exactly, sunshine and light either. It was, so after, and if I had to do it over again, I think I'd wait 6 months before I told family and friends what was, what the situation was. We only waited like 3 weeks and said, let's let everybody know. And so we're not keeping secrets or telling part of the family and not another part of the family. So we said, look, we're just going to put this out here. People deal with it the best they can. And was probably, in hindsight, I would recommend to somebody in the same situation I was in, wait 3-4 months before you talk to people about it, except for obviously your spouse and your kids and all that. But anybody outside of that inner circle, I would have waited if I had to do it over again. That's all I got.
Len, are you trying to talk? Because I think you're muted.
Yeah, you're right. Sorry about that.
We missed all your words of wisdom.
There were no words of wisdom. You probably never get words of wisdom from me. Don't worry about that. I just said we should move on now to Ken Anderson. I believe he wanted to talk tonight.
Okay, well, my question was in regards to a request that I put to my medical oncologist and starting enzalutamide. I have one additional round of Provenge, which is next Monday. So I have the leukapheresis on Friday and the round of Provenge on Monday. My local oncologist wants to wait until, after I have scans, and that would be sometime middle of next month, I would imagine, before we decide to start enzalutamide. I'm pretty confident my PSA is going to be well above 3 on the 20th. I think next Wednesday I go in for my next PSA. I know Rick was pushing me to start it at the same time. For some reason, the local med-onc here is not on that same page. Any comments from anyone? I know Rick was pushing to do them both at the same time. I put a request into Paul Korn, but I haven't got a reply back yet.
So Ken,
so my question,
go
ahead.
Are you castrate resistant? Has your PSA risen 2 or 3 consecutive times while you're on Lupron?
Yeah, it's risen 5 times.
Okay.
So what would you do, Len?
I would, I think as soon as you complete the Provenge, I would start the enzalutamide.
I don't think waiting for a scan is going to do anything.
You don't think Provenge is going to do anything?
No, waiting to see a scan, I mean, I don't know why wait for a scan if my PSA is above 3. Why don't I just start the next drug?
Yeah.
I think I'm going to be a little pushy with her and just say I want to start it.
Yeah, I understand that. I agree with you. I don't see the point of a scan at this time. Maybe after you're on enzalutamide for a while, if it goes to undetectable and you want to take a drug holiday, that might be time to consider a scan. But the only reason I would hesitate to start the enzalutamide while you're doing Provenge is you might want to make sure that you separate out the side effects of Provenge from the side effects of enzalutamide.
Okay. Well, I must admit, I haven't really had any side effects from Provenge, so I go in and they do their thing, and I get the infusion on Monday, and I go out, and I don't really feel, other than upon the first infusion, I felt a little, maybe it was mental, but supercharged a little bit, but I don't know. And it could have been just a little bit of drugs that they gave me. They give you like 2 or 3 ibuprofen and a couple antihistamines for some reason when they infuse the Provenge back into you. So I don't know. I haven't really had any side effects, but I don't mind. I know my PSA is going to be above 3, and I've told myself when I got to 3, I'd like to start enzalutamide. So, but I'm going to push her because I'm going to be out of town. As soon as I finish Provenge, I'm leaving Arizona for 5 weeks, and I don't want to give the cancer another 5 weeks to continue to do what it's doing.
Oh, yeah. In that case, definitely at least get the script so you can start when you want rather than have to wait 5 weeks.
Yeah.
Where are you headed now?
Provenge is
Say
no
that
cheap.
again?
Where are you headed on your 5 weeks departure from Arizona?
Well, I'm going to go to the Northwest and visit with family and spend time boating and kayaking.
That's great. And why did you select enzalutamide? I thought you were going to do Zytiga.
I'd asked Paul Korn about, the different options, darolutamide, Zytiga, enzalutamide, and he said he would do enzalutamide because of Provenge. He said using a steroid has an immune suppression, and his choice after Provenge would be enzalutamide.
Okay.
That was his choice, but
Okay.
why are you thinking? You thinking something else, Len?
No, I guess there might be something to that. It's true. Prednisone does suppress the immune system to some degree. This is very low dose prednisone that you take with Zytiga, and I wouldn't think that it would suppress your immune system in any significant way. But so I'm definitely not going to second guess Paul Korn. They give you the prednisone because Zytiga suppresses the body's natural production of cortisol. And so when they give you the prednisone, all they're aiming to do is replace the corticosteroid naturally in your body called cortisol. They're just trying to replace that so that you don't have other symptoms develop as a result of low cortisol levels.
Right.
But nevertheless,
yeah, I hate to try to second guess Paul. If that's the one he says I should do, that's the one I'll probably start. So
yeah, I agree. The only reason I was questioning is because I know that for most people, enzalutamide is the most fatiguing of all the second line anti-androgens.
Well, I guess I'll just have to work harder.
Yeah, you may be different. I think Jake tolerated it very well. some
I did.
people, yeah.
It definitely did fatigue me though, but yeah, I tolerated it quite well. Just plan to take extra naps during the day. That's all.
Well, I stopped working mostly, so I'm trying to find stuff to do, so a nap might be in order.
There you go.
So I'm not sure what the scan is about, because Provenge is notorious for leaving no tracks or traces. I mean, your PSA rarely goes down. I mean, there's hardly any evidence of the fact that you've been on Provenge. It's kind of a little bit of a guessing game that can go on for a long
Yeah,
time. Yeah, and
yeah, I don't know why. I don't know why she wanted me to wait until after scans to start the second line. It's like I don't really think she's gonna see. I mean, I had a scan in December, a PET scan at MD Anderson, and I did put a request into Paul since she was kind of pushing for me to have another scan. I put in a request to Paul about a week and a half, 2 weeks ago to come visit him during when I was up in the Northwest, just kind of go to MD Anderson for a couple days and have scan and chat with Paul a little bit, then fly back and finish up my visit with family. But not sure that and Paul didn't reply real quick. And normally if it's kind of low on his radar, his non-reply is like, it's not such an important topic. So if it's important, he'll usually reply real quick. But if it's one of these not such a big thing, I don't know. I just don't know if it's a big thing. And I must agree, Peter, I don't think there's going to be too much evidence from the 3 rounds of Provenge in regards to, PSA decline or I mean, there really weren't any signs upon the PET scan other than something in my prostate that we came to the conclusion was inflammation or something, because I had a biopsy and it wasn't cancer. So I guess I'll just wait for Paul's reply and kind of push her before I leave town to at least write me the script for enzalutamide. I think you froze again, Lan.
Okay, well, good luck with the enzalutamide.
Okie doke, thanks.
Let's see, we can move on to Jim Ward.
Hey there.
Hi, Jim.
Hey, this is for the veterans of radiation therapy. I'm getting my treatment done at MD Anderson, and I just finished treatment 9 of what I think is going to be 38 or 39 treatments. And this is just kind of a 2-level question. One that's kind of geared to just more of how, what tips for kind of just dealing with the physical side of it and getting through it. And I can't really say I've experienced too much in the way of side effects, but I also know that there's a delayed onset of those somewhat. And then the other question is a little more existential, which is just, how do you deal with just this extended period of treatments where you're just going in every day? And I don't know. It's just, as Ken knows, I've kind of been communicating with Ken that part of it is just, even though it's been going fine and smoothly, I don't know. It's just, and I know it's for the best. I know it's, should provide some benefit, but it just seems like a long road to hoe.
Well, I can tell you my experience. I had 48 straight sessions of IMRT at Sloan Kettering. Wow. And maybe I was more fortunate than most because I really didn't have any side effects. And 15 months after I started developing radiation proctitis, so some rectal bleeding when I have bowel movement. But throughout the 48-day session, I think there was a period of a few days where my bowels got pretty loose. May have had a little bit of diarrhea. I never even took um, Imodium or anything for it. I just changed the diet, eliminated fiber from my diet, didn't eat spicy foods, and that's about all I did. And I know everyone, of course, reacts differently. I know Peter said he had some fatigue after the radiation. I've heard of other guys having fatigue. That didn't affect me at all. As far as the, going through the grind of so many sessions, I think you already put your finger on it. You just keep your eyes on the prize. At the end of all of these treatments, you may have, hopefully you will have a very long, durable remission. I was able to go on drug holiday for 28 months following radiation. So, yeah, just be optimistic and hope for the best. And I think you'll do fine. Anyone else want to talk to Jim about their radiation experience?
Yeah, Jim, you're not a native of Houston, are you? You parked yourself there for this thing?
Yeah, I'm not. I lived here for 2 years right out of college, so I'm familiar with it. And my sister's lived here for over 30 years, so I'm not a complete fish out of water. But yeah, I'm parked here for 2 months, and away from my wife and our four-legged kid, and so I'm thankful that I've got my sister here. But it would have been easier to stay in Kansas City, but I think most people on this call kind of know the what sort of turned out to be kind of a no-brainer decision to come down here and get it rather than Kansas City. So,
Right. I think I mentioned this before in a previous call. My home is in Hawaii, in Maui, and I chose to do my radiation in San Francisco. And people were generous, gave me places to stay. I had to commute an hour on the BART to just get to the hospital. And then I parked myself there because my bladder was so active. I didn't feel comfortable going out for several hours because I would have been running to a bathroom all the time. Just
right.
They had a place upstairs where I could use the computer and hang out for a while. They were really nice to me there. And then I went out and it was an adventure. I went to the zoo. I went to museums. I went to theaters, to movies. I was on the go every afternoon and evening, and kind of made myself at home and explored San Francisco. I don't know what Houston's like. I think you have to drive around probably a lot more than it's not a commuter type of walk around city. But I'm sure there's things to do. Sports games, this and that. I mean, just kind of take it as an adventure. So that you're not just focused on the radiation. And also make sure you have a nutritionist there so that you can get a special diet, because you want to start eating bland food. I found 2 weeks into things, my stomach was pretty upset, and I had to stick with white rice or mashed potatoes, something really bland, easy to digest. And you don't want to eat a lot. Another possibility is joining a gym. If there's a gym connected with MD Anderson there, oftentimes the big hospitals have a sports center or gym connected with them, where you can join by the month or whatever, and just work out for an hour or two, or pool or whatever, as much as possible. That's it's a good healthy diversion to counteract some of the effects of the radiation as well. So those are just diet.
Well, no, that's all very helpful, and we don't have to spend too much more time, kind of talking about this situation, because all in all, I feel fortunate that I'm able to do it here, and I have felt some fatigue. I think somebody mentioned that maybe Peter had some fatigue right after the treatment. Right after the treatment is when I have felt some fatigue. It's not overwhelming, but it's just like yeah, where I'm living, I right after the treatment, which is early in the morning, I climbed 4 flights of stairs, and I'm a pretty fit guy, and climbing 4 flights of stairs is nothing. But boy, coming right after that treatment, getting up those 4 flights of stairs, I feel it, and I feel just a little bit sluggish for about an hour or 2 after the treatment, and then I pick myself up, and I have been exercising, and so I feel like I'm doing okay all in all. But that adjusting your diet and cutting out fiber and eating bland foods I haven't resorted to that yet, because I can't. That would be a very difficult adjustment for me, because I eat a lot of fruits and veggies. I always did, and I've just stepped up that consumption since the diagnosis. So it's really difficult for me to even contemplate giving it up and eating a bland diet, just because I feel like I'm kind of turning my back on good nutrition. So it's one of those catch-22s, and the literature said, well, don't overexert yourself, and I was like, well, wait a minute, I thought we're supposed to be exercising here. And finally, when I talked to the radiation oncologist, she said, exercise as much as you want to. Obviously, if you get really tired and fatigued, your body will tell you so. And she said, eat what you're used to eating, and don't drive yourself crazy trying to, make all these crazy adjustments, and unless and until you start having some real problems. So, I think it's just sort of trying to grapple with, all these different variables and all these different factors. But, I appreciate the tips and the people kind of sharing their experiences. I really do.
Yeah, Jim, it's Ken Anderson. I just want to say, keep focused on the ball.
Yeah.
Are you there?
No, you're right. Yeah, I'm here.
How often do you meet with your doc? Every week?
Yeah, every week. Yeah.
Yeah, it won't take long, and you'll bang it out. So.
Yeah. It's a good point. Like everything else in life, it seems like it's a long slog ahead of you, but then all of a sudden it's behind you, and you're glad you did it.
Well, yeah, and I'll tell you, the prize is not only finishing it, but Len, when I hear that kind of enables you to take a drug holiday for as much as for over 2 years, I think that's a huge incentive for me, because I'd dearly like to do that.
Okay, anyone else want to talk to Jim about their radiation experience?
I think I got almost 2 years out of drug-free existence after it as well. Yeah, it's pretty common. You'll do fine. And don't.
Oh, that's great to hear, guys.
Don't worry about the diet. Your stomach will tell you about the diet. If you start getting an upset stomach at 2 weeks in or something like that, just make some adjustment. That's all. It'll tell you.
Yeah. All right. Thanks again, everybody.
Now I see we have Debbie on the phone, or maybe on the computer. Is that Debbie Burhans? Is that you, Bill? Hello? Debbie? Can you let us know you're there? You're muted. There we go.
There you go. You can hear me. I'm using my wife's, this is Jerry Pilfrey. I'm using my wife's laptop.
Oh, okay. Now, Jerry, you said you wanted to talk to us tonight?
Well, I hadn't commented for quite a while. And like I've said before, I'm really a newbie at this, since it's only been around 7 months since I was diagnosed. And of course, it's the same thing. It's Firmagon for a month, and then on Lupron, Zytiga, Zometa shot for a year. I go to Mayo, and what I find interesting for me, and if you guys can think back when you were 7 months into it, is the imaging side of it. I haven't had any imaging until just recently, when I pretty much almost had to beg my urologist to do a CT urogram. So when, in your opinion, should the imaging start in the process?
The question is, when should you start imaging?
When, in your experience, if you can remember back, when did the imaging start? After you were diagnosed, in your process, 3 months in, 7 months in, a year in, when did they start doing a CT or an MRI on you?
Yeah.
Jerry, this is Jim. I could just tell you that as soon as they did my biopsy, and within 3 weeks, and they did the biopsy within 2 weeks of confirming my PSA, they had me in for a bone scan and a regular CAT scan. And then they did it again when I switched to an oncologist. They did an MRI, an axiom scan, and that was within 10 months, less than 10 months of when I was diagnosed. That was my experience.
Well, I had all the original, the biopsy, the CT, the MRI, the bone scan, all of that up front. But that was 7 months ago. And it just seemed to me like, and as a matter of fact, I was listening to a seminar, and I'm not going to pronounce his name right, but it's Dr. Cowan, Kwon, from Mayo in Rochester, and he was saying that imaging was really important, and that they should be doing more imaging than less. And here it is, 7 months, and when I asked my local oncologist, he said, "Don't worry about it. We know what's going on." Well, to me, that's BS. I want to know. I want to see what's going on.
Jerry, has your PSA been stable, or it's going up, going down? What's it doing?
Oh, it's still going down. The last one was 0.4.
Yeah, well, that's good. That's a good sign, and I think what they're looking at is that fact that it's going down. There really isn't a need to do any imaging. If it just continues to do that without going up again, probably once a year for imaging. But if it starts to move, then it's indicating that something is not working right. The drugs you're on, whatever, is not working right. And then they want to go back in and do a detailed scan, one of the axiom scans or something like that. But then they'll know exactly what's going on for sure, and possibly have to change your treatment plan.
Yeah, understand. It's just that there are some beliefs out there that the ADT, doesn't really do away with all of the cancers, since every cancer cell has the capability of regenerating into a different type. So that was my only question. I was just wondering, and that it sounds reasonable. Everything's going right. You know, 7 months ago, my PSA was 3,193. So at 0.4 today and going down, I was just wondering about the experience of imaging. So thank you.
Oh, that's a remarkable response. That's fantastic. Congratulations. Yeah, my experience was that 7 months after I started ADT, I was re-imaged. And I'm not, it's funny, I did not ask at the time, why are you re-imaging? But I think they wanted to simply verify the extent of the response. Like you, my PSA was going down. And, in some cases, you may have a lymph node that showed up on an MRI that appeared to be larger than it should be. And the only way they can be sure if it contains cancer is if after starting ADT, it shrinks. Then you know that was cancerous. If it doesn't, it probably wasn't cancer, just some form of inflammation. But yeah, I understand in your case, since your PSA started so high, why you might want to have an extra assurance that things are working the therapy is working as it should. So I don't know. Maybe you could push for it and see how much pushback you get from them.
Well, I'm going to be at Mayo September 9th with Dr. Singh. And believe me, I've got more than one question that he's going to have to answer. So that's definitely in my plan.
Right. Does he work with Dr. Kwan?
Well, Dr. Kwan is at Rochester, Minnesota. He's at the home base. He's the chairman, I believe, of the oncology department there in Rochester. But I don't know if Singh works with him or not. I don't know if there's any communication between Phoenix and Rochester. That would be a good question.
I thought you said you were going to Mayo.
Yeah, Mayo and Phoenix.
Oh, okay.
Yeah.
Yeah, that's where I go, Jerry, and I see Dr. Singh also. He's my main oncologist, and I have a local oncologist, and that the both of them know each other. They're both from India. The guy I see locally in Tucson is also very good. So I get my blood work done there, and he does my prescriptions for me and stuff like that. And then I go up to see Dr. Singh now once a year, and there's been no problem with, he sets up the scans, and either I'll do it at the hospital where he's located or at the clinic, depending on what's available.
Yeah. How long are you into it?
About 3 years.
And so you've been seeing him for 3 years?
Yeah, he was actually down here in Tucson at the University of Arizona Cancer Center. When I had to make my decision, after my urologist gave me the data, and then I had to make a decision on where I wanted to go for treatment. And I said, if I could find somebody locally that's got a lot of good recommendations, that I'll do my treatments locally. And I put out a lot of feelers around the country, and I said, for Tucson, who's the best prostate cancer oncologist, genitourinary? And one name kept coming back, Dr. Parminder Singh. And he was at the time teaching. He was also involved in clinical trials as well as practice. And I went in to see him, and right away, he got me in right away, and we were pretty aggressive right from the start because I was metastatic upon initial diagnosis. So we went with chemo, Firmicon, Lupron, and then he left and went up to Phoenix, and I had heard another doc down here who was terrible. So I called Singh and said, "Yeah, come on up and see me." I said, "That's fine." So I went up to Phoenix. They did the Axman scan and found, sure enough, even though I kept telling the other oncologist, my PSA keeps going up. He said, "Oh, you're fine, you're fine." I told Dr. Singh that. He said, "No, you better come up here." They went up and did the scan, and sure enough, they found new metastasis. Had 2 new metastasis at the time, and that's when I went on they have the tumor board there, so you got people, surgeons, radiation, and medical oncologists, and so forth, and they come to an agreement for each patient before they make the prescription, and that's why they put me then at that point on Zytiga with the prednisone.
That's interesting. You say there's your group of doctors includes a surgeon.
Yes. That's why, if you just go to one oncologist or urologist and you take their word for it, well, some of them are radiation specialists, some are surgeons, and some are medical oncologists. And
Oh yeah.
they have an axe to grind,
No,
So
no.
that's what I liked about the Mayo and Dr. Singh is they took all my scans, all my data history, and so forth. And when they looked at it, they came to an agreement what the best course of treatment was for me. And it's working like a champ, so I can't.
Oh yeah, I can't complain about what he's doing. It's working.
He's a little difficult to understand sometimes, but he always answers my questions. And
yeah, yeah. His nurses are good at getting back to you also.
Yep.
Yeah. No complaints there.
Good.
Well, the other thing to consider is if you're going to get a scan, make sure it's a scan that's sensitive enough to pick up your very low PSA now.
Yeah. No, I understand that. There was, oh God, I just glanced at it last night. The efficacy of the scan, I guess, that they use, where prior to not having a PSA of 2 or lower, they were having a hard time. They've gotten that down to 0.9. So it is getting a little better detail, if you will. I forget the procedure off the top of my head for that. But no, that is very important. And at that time, we'll have our discussion.
Okay.
Another good guy to talk to in the Phoenix area, if you want another opinion on scanning, is Dr. Fabio Almeida at Phoenix Molecular Imaging.
Who?
Dr. Fabio Almeida at Phoenix Molecular Imaging. He knows his stuff. He's got a number of different kinds of scans on trial and other things. And depending on your insurance, he might be worth sitting down and having a talk to. Concerned about accurate imaging and so forth. I'd be curious when you say 0.9 whether they're talking about using oxamin or something else. Whether it's a PSMA scan or not.
Yeah, I can't tell you for sure, but I think it was PSMA.
That would make sense.
Yeah.
We had someone else just join us on the telephone. Which care to identify?
Caller number 4. Jake, do they know what number they are?
No.
No.
But they know that they just joined on the telephone. Somebody just joined about 2 or 3 minutes ago. That's all right. You're welcome to listen.
Yeah. Okay, then. Peter, I guess we have time for you to tell us about PCRI.
Yes, Bill Franklin and myself and Ken Mason are going to go. And Sylvester, are you going this year?
Oh, yes. Yes, I'll
Okay.
be there Thursday night.
Okay, so will we. So will I. So look me up.
I certainly will.
Yeah. So I'm excited about it. There's a new video. It's actually last year's presentation by Eugene Kwan, Dr. Kwan, who was just mentioned from Mayo, speaking in a promotional video about, if you look at PCRI.com, you'll see it. And, it's a very genuine promotional video where I don't know if you remember last year, Dr. Kwan speaking about the fact that he doesn't go to other medical conferences. He avoids all the medical professional ones, but the PCRI conference, in his estimation, is the go-to conference because it's got the best information and it's geared toward patients. It's very heartfelt and a beautiful presentation. Anyway, that said, if you're considering it, it's a remarkable conference. If you've never attended it before, and you want to access, all the latest and most up-to-date information about treatments and scans and genetic information, there's nothing that compares to the PCRI conference. It's affordable and it's there. So I just want to let you know that if you're thinking of coming, I'll be there. Sylvester will be there. Bill Franklin will be there. We'll have a table there for Ann Can, and stop by. We'd love to meet you and say hello. It's just, I'm not, I guess I am plugging it. I don't know why. I don't get anything for plugging it. But
Is this the September 6th to the 9th?
Correct. Yes, this will be my time going, and I always learn something, and it's the access you have to the physicians there, and the knowledge you have. I mean, a lot of my treatments have come direct, and knowledge about doctors have come directly out of this. Last year, I had 10 sessions of proton beam radiation from a California Proton Center down in San Diego. And I met the doctor several years ago at the conference, so it was a no-brainer for me when I discovered my metastasis, where I wanted to go and what I wanted to do, and I'm really glad I did. So it's not like just another medical conference. It's pretty unusual that doctors are that passionate and accessible and dedicated toward listening and helping and inspiring you to seek the best. So that's my plug.
So I didn't know that, Peter. You had first heard of Dr. Rossi at PCRI?
Yeah, I met him about 3 years ago doing a presentation on proton beam. It stuck with me, and I realized that he had a wealth of experience. I think, and this year they've got Dr. Patel there, who's the foremost authority on surgery. I mean, he's done like 14 or 17,000 robotic surgeries down in his place in Florida. This will be his first time speaking there. So a lot of the big names, have availed themselves to this, and they don't make money going to this conference either. They're just there, not to sell their services, but to put out different possibilities and let it's all under one roof. What might work for you. Yeah, that's where I met Dr. Rossi was at this conference 3 years ago.
That's great. That worked out very well for you.
Yeah.
So, do you think there's any reason why I should seek proton beam therapy for that lesion on my right hip as opposed to the typical SBRT?
So so your lesion did come back positive?
Oh yeah, I didn't tell you guys this, I guess.
No.
Yeah, the biopsy was positive. They said positive for PSMA and also PAP, which I thought was interesting because, as Ken may know, Provenge is incubated when they take your lymphocytes out of your body and they take it to the lab, and then they incubate your lymphocytes with the antigen PAP, prostatic acid phosphatase, so that when they infuse it back into your body, the lymphocytes are trained to seek out that antigen PAP. So I figured, hey, maybe I'm a really good candidate for Provenge as soon as they finish radiating. But first, I guess I'll have to find out if I'm castrate resistant or not. I'm going to go back on Lupron actually in 2 days. So if my PSA continues to rise on Lupron, then I'll be eligible because I know you have to be CRPC. But anyway, getting back to the question, Peter, what do you think?
Where on your spine is this?
Not my spine. It's the crest of the right hip bone.
Iliac.
Right iliac bone. Yeah.
Is it close to anything that could be compromised?
It's very close to the surface of my skin. Yeah, there are no organs there.
No organs. Okay.
So that's why I thought probably not necessary to use proton beam.
Well, I would consult with both. I would consult with a proton beam radiation person and an SBRT person and talk to them both and talk about the side effects. You know, I don't know in terms of skin burn or anything like that, if it's that close to the surface, what the ramifications are. I have no idea. But I would, if it was me, I would get as much information as you could. And I was really pleased with my proton beam radiation. I thought it went well. I mean,
yeah.
This puts you in what, the oligo state, yeah? So you can get a lot of mileage out of whatever you do.
Right. Is there a difference between SBRT and proton beam in terms of the number of treatments, of sessions?
Shouldn't be too much. No, if it's just one lesion, it shouldn't be too much. Probably five sessions would be my guess. I don't know.
Of proton beam or SBRT or both?
I had 10, but I had two metastatic lymph nodes in my abdomen. So I don't know. You'd have to talk to a radiation oncologist about it.
But I think that at least in the pelvic region, guys who get SBRT radiation typically have it done in 5 sessions, whereas
right.
If they have proton beam, they'll have about 40 sessions.
Now,
I don't know.
That's different from my experience. I had the choice with proton beam of getting one shot, and this is palliative, or coming and having 5 sessions. And he said he based the fact that he gave it to me all at once on the healthy condition that I am in for my age. This was all palliative. It was from, excuse me, approximately C5 to T7. And if you can think about the area between your shoulder blades, that is the main area of my metastasis. So I had no side effects from it at all, and it helped definitely with the pain. That was my experience.
And that was proton beam?
Yes.
Well, when I said 40 sessions of proton beam, I wasn't talking about targeting a single lesion. I was talking about primary therapy for prostate cancer, where they radiate your entire prostate gland.
Right. That's a whole different game than what you're.
Yeah.
Whole different. Yeah, I would definitely consult with both.
Yeah.
Who's doing it on the East Coast? Who's been doing it for a while and what facility has it? But I would for sure check into it because Medicare does pay for prostate cancer now in proton beam.
Medicare will cover it?
Yes.
Good to know. Well, I endorse Peter's endorsement of PCRI. I've been to that conference a few times, and it is an excellent conference. You do learn a lot. You get to network with a lot of guys, and as well as physicians. It's very well managed. And it's only, what is it, $75 registration fee, Peter?
$30.
Or 30?
30, yeah.
Wow.
He said if you sign up for all the free breakfasts and lunches that the drug companies give you, you don't have to eat it all.
Yeah, that's right.
My wife and I just got back from a one-day conference put on by Arizona Oncology. And of course, you get a kick out of this. It was put on in Sedona. So typical radiologist, whether you're an oncologist or medical radiology, so it wasn't, it was a pretty good, my wife got some interesting information, and so did I for the one-day seminar that weekend. But I thought it was interesting that Arizona Oncology would put it on, although it seemed like most of the people that were putting it on were from the Flagstaff area.
Interesting. Did they do any of the crystal treatment?
No.
Crystals over you?
No, there was none of that. We weren't in the vortex, and we didn't have any crystal treatment, unfortunately.
No Sedona. One thing that for people that have a connection to the internet for their TV, UC University of California TV that you can get as an app has the conference that was put on by UC San Francisco, and all the lectures on prostate cancer, from the very earliest easy stuff like nutrition and all that to the most complex genetic stuff, are all on there, and it's completely free. It's UCTV, I think it's .edu, but it's an app that you can get on any device. And if you go to the medical area, they have all the lectures from the University of California at San Francisco about prostate cancer.
And I second that because I've listened to a lot of those. It's a good TV channel for medical.
Yes.
Right. Yeah, actually, it was a very good conference. It was a one-day event. The only drawback was they were moving very fast through it because they had to fit it all in a day. So it was very.
It wasn't the best production in the world, but the information was good.
Yes, I agree.
Someone just joined us again on the telephone.
This is Jim Ward. I dropped my call. It's probably me who rejoined like 10 minutes ago.
Okay, welcome back.
Thank you. So what's the name of this app? I heard someone say uctv.edu, but
it's a app that you can get through if you have a Fire Stick, or I think you can. I'm sure you could do it on your computer. Or I do it on my smart TV, and I loaded it as an app. And same thing with the University of Washington, but the University of California had the whole day of lectures that they recorded, and they broke them into, I think, 4, maybe 5 sessions, from the most basic prostate issues to the most advanced. And
yeah, all you really have to do is Google UC TV. And
yeah, and you'll find it, and it's all on there. And it was especially the part about the advanced was very, informative for me. And they were talking about genetics and what they're doing in the new phases of the medicine, where the research is. It was fascinating. I'd recommend anybody watch at least all you guys are advanced, at least watch the advanced one. It was excellent.
Jim Ward, was it you that was speaking at the beginning about a contact for a relative who's got low-grade disease and just starting out?
Yeah.
The other Jim.
Okay. Right. So that's me, Peter Kafka. I run the group on alternate Mondays, the second and fourth Monday. So next Monday, same time, same phone number, same everything. I have the group for an hour and a half, 8 to 9:30 Eastern time, or whatever the corresponding time zone is.
Okay, yeah.
We've been doing that for years. Yeah, we've been doing that for years. So he's welcome to join in. And it's low, intermediate, and active surveillance. And we'll make sure that we don't steer him toward radiation or surgery or anything over the top. Our motto is to head them off at the pass. Make sure no undue treatment or gets pushed into anything, and gets the best information they can. So next Monday.
That sounds good. Okay, so same bat channels, same everything as far as the phone number and the code.
Exactly. Personally, I have more advanced disease, but I got into this years ago by helping a buddy in Minnesota with it was called the Reluctant Brotherhood then, and that turned into the low and intermediate group, and I've been doing it for whatever it is, 3 or 4 years now to this day. And it's a great group of guys with a lot of good information.
All right, thank you. I'll get the word out.
Guys, we've got 5 minutes left. I believe I went through the list of everyone who said they wanted to take some time tonight. Any other thoughts?
Did you ever ask Len if he was going to talk today?
Sorry?
Did you ever ask yourself if you were going to speak tonight?
Oh, well, I guess I just did. I had a biopsy done at the NIH. Well, first I had the what is believed to be the most sensitive scan available. It's in part of a clinical trial at the NIH. It's called 18F DCF PYL PSMA PET scan, and it revealed a lesion in or an area of focal uptake, as they call it, in my right iliac bone, anterior right iliac bone, which is the front of the right hip bone at the crest of the top. So if you rested your hand on your hip, that's exactly where it would be. And they called me back for a biopsy, and I talked about that last week, how that procedure went. And now, just a few days ago, they called me and told me that the biopsy was positive. It actually took 2 cores or samples of tissue. One was negative, but the other was positive. And they will eventually do a genetic sequencing or mutation analysis of the tissue sample, but that will take a few weeks. And it was simply described as positive for PSMA and PAP, which I mentioned earlier. That is one of the antigens that is targeted by Provenge. And the other thing they said was that it was moderately differentiated, which I'll have to ask my oncologist when I see him on Wednesday. To me, that sounded kind of a good thing, because as I'm a Gleason 9, and typically Gleason 9 has a highly undifferentiated cell morphology, which means it's basically a mess. It doesn't look anything like a normal prostate cancer cell. So the fact that they said this one was moderately differentiated makes me think maybe it's not one of the more aggressive types of prostate cancer. But I'll have to ask my oncologist to be sure about that. And in any case, I suspect he will want to do some spot radiation with SBRT. But after having heard from Peter tonight, I'll ask him about proton beam if he thinks there's any advantage to doing that. So that's what I was going to talk about. If anybody has questions, be happy to field them.
Yeah, Lynn, where's your PSA right now?
It was 2.4 before they did the biopsy. And that made me wonder, like, gee, I wonder if, they take the biopsy, they're removing some cancer cells there. I wonder if the PSA goes down.
Well, you can grin for sure. You can grin for sure. So when did you decide to go on ADT? Go back on ADT? Was it earlier?
Well, as soon as I had the biopsy done, which was now about 10 days ago, I started taking bicalutamide, 50 milligrams a day, so that when I see my oncologist this Wednesday, he can give me the Lupron shot.
So you've not done a second line yet? You've just been on Lupron, on and off.
Well, there were, my case is bizarre, a bit weird. Post radiation, I was 0.1, and my Sloan Kettering oncologist said, okay, I think you can go on a drug holiday. So I said, I'm not so sure about this. Let me get a second opinion. So I went to the current oncologist I have, Dr. O at Mount Sinai in New York. And he said, we can put you on drug holiday, but first I'd like to see if we could get that 0.1 down to undetectable. So I was on Lupron and Zytiga for 3 months. And I guess we had kind of a disagreement on the terms. I told him, all right, I'll go on Zytiga for a few months. I'll give it a few months to see if it'll take it down to undetectable. And it hadn't. As I mentioned before, I actually had a flare, and the PSA went up the first 2 months, but then the third month it went down, but it still hadn't gone down even to the 0.1 level. So I said, look, I'm happy enough to know that Zytiga works when I need it. Right now, I am more in need of a drug holiday, and that's when I began what turned out to be a 28-month drug holiday. So I was on Zytiga for 3 months.
Gotcha.
Yeah.
Well, hopefully when you find out, you will not be castrate resistant.
Yeah, I guess that's good. But on the other hand, that would mean I wouldn't be qualified for the Provenge. Either
No,
way,
I take the first.
yeah, I guess you're right. Yeah.
All
It was,
right, well, thank you.
I had the same dilemma with the biopsy. You know, I said, okay, if the biopsy is negative, then we still don't know why my PSA is going up. If it's positive, at least we know and it can be treated. So I figured,
No. The
you know,
knowing is all powerful. The non-knowing is nada. So even your scans, you know, you had made the comment that it was a double net. You know, unfortunately, you found out that you had Mets, but you did find out. So I don't know. Knowledge is power.
yeah. Yeah.
All right. Thanks for the story, though.
Oftentimes you'll hear people saying they were very sick, nobody could diagnose them. And then when they were finally diagnosed, even if it was a grim diagnosis, they were happy just to know why they were sick, right?
Right.
So, Len, not to drag this on, but when you compared the Oxyman scan you had, did that indicate this iliac business at all?
Nothing. Absolutely nothing.
That's interesting.
Yeah.
Interesting finding.
And I also had 2 bone scans, the technetium 99M bone scans, and that revealed absolutely nothing. So obviously this PYL scan is very sensitive and it's important. You know, if it wasn't there, I would go on my merry way thinking I don't have any bone lesion, and it would just get worse. So I hope that it gets approved real soon and that it becomes available for everyone.
Yeah, this is the future. This is going to be the future, and it's why whoever speaking before about the Phoenix thing at Mayo and the importance of scans. Scanning is going to be more and more important in the future because of the high-tech scans that are now available, and they're not available to everybody. Where I live, you can't go near it. You've got to travel 2,500 miles to get access to something like this. But it's
what is it?
All right.
Sorry, what does the PYL stand for?
Oh, it's an unpronounceable, extremely long chemical name. It's irrelevant.
Okay.
Yeah.
Okay, but that's what we call it, PYL scan.
For short, they call it PYL. Yeah, it's actually 18F DCF PYL. And the DCF PYL is the very long chemical name. The 18F, of course, that's the radioactive fluoride ion, which is used in a lot of different scans.
Len, did you have any physical symptoms that led you to go get the bone scan or the bone biopsy and do all that? Was there anything that tipped you off?
Yeah, rising PSA, but that's it.
That was it. Okay.
Nothing else.
Okay. Thank you.
Sure.
Len, I have an irreverent comment to make. You mentioned your hand on your hip to describe where your med is, and you mentioned it one time before. And you know what I always think of? It's the Rocky Horror Picture Show. If anybody's seen that movie.
I've seen the movie, but many years ago, I don't remember the connection there.
You know, there's this old guy, Charles Grant. He's dancing on. He's like a school teacher or something, and he's dancing on his desk. You know, put your hand on your hip, and you know. I hear a couple people giggling, so they know what I'm talking about.
Yeah.
Yeah.
So the only thing I'm going to take offense to there is the fact that he was an old man, and you're equating me.
I'm sorry, but that's every time you say that, that's what I think of. But that's what the image that pops into my head.
Yeah.
Of course, there's not a whole lot of room in my head for anything else. So.
Yeah, I'm already beginning to feel, unless it's psychological, I'm already beginning to feel extra fatigue just from being on the bicalutamide. I don't know if that's typical, or anybody who's started bicalutamide before Lupron, did they already begin feeling fatigue?
Oh, yeah.
Oh, you did? Okay. All right, gentlemen. We've wasted another perfectly good 2 hours of your life here, but I hope you learned something.
Good call, Lynn. Thank you very much.
Good.
Thank
Thank
you.
you.
Thank you.
Thank you for doing a good
Have a good
moderating job,
evening.
Len.
Thanks.
Thanks,
Thank
Good
you.
night.
Good night,
Always a pleasure.
Yep.
Okay,
Thank you.
we'll see you
Good night.
next time.
Oh, boy, babe.